Welcome to Leading Veterinary Teams, the podcast for people-first leaders in veterinary medicine who are ready to ditch the burnout script and lead with purpose. I'm Suzanne Thomas, veterinary technician, executive coach, and fellow leader in the trenches. Around here, we talk real-life leadership, boundaries, influence, team culture, and what it actually takes to build happy, high-performing hospitals. No fluff, no guilt, just the truth, some tools, and maybe a little tough love. If you're ready, let's get into it. Welcome to Leading Veterinary Teams on Air. Today's conversation is one that's going to hit home for a lot of us. We're diving into moral distress and moral injury in veterinary medicine. These are the moments when our values collide with the realities of the job. When we have to stand by and watch a patient suffer because of financial limits, policy barriers, or leadership decisions that go against what we believe is right. Joining me today is Kristin Lake, a credentialed veterinary technician who has spent her career in emergency and critical care. She is the author of the Veterinary Technician's Guide to Emergency and Critical Care and the founder of Vet Med Math, Stat Math, and Vet Med Rounds. Kristin brings not only deep clinical expertise, but also lived experience. And she's been speaking candidly about the emotional toll that moral distress can take on veterinary professionals, especially technicians on the front lines of care. Today, we're going to dive into where moral injury shows up in vet med, how it's different from burnout, and what leadership can do to prevent it. Because this isn't just about hard days, it's about how we help our people carry the weight of compassion without breaking under it. Kristin, thank you so much for being here. This is such a heavy but really important topic. Before we get started, can you share, for anyone who doesn't know you, a little bit about your story and why this topic matters so much to you?
Yes. So this topic matters so much to me because as an ER and ICU veterinary technician, I am constantly dealing with pet parents that are presented with estimates that are thousands of dollars, and they don't have pet insurance a lot of the times, and it restricts basically the care that we can provide to their animals. And it becomes very morally distressful when we're not able to provide the care that we know we can because of finances. Unfortunately, with moral injury in vet med, it's sometimes unethical treatment of a patient that goes against one's moral compass, but most times we're dealing with financial restriction that prevents us from acting in the way that we need to.
Can you help us define what moral distress and moral injury actually are and how they show up differently from, let's say, burnout or compassion fatigue?
Yes. So moral injury can occur when someone engages in, fails to prevent, or witnesses acts that conflict with their values or beliefs. This can be having to make decisions that affect the survival of others or where all options will lead to a negative outcome. Doing something that goes against your beliefs. This is referred to as an act of commission. Failing to do something in line with your beliefs. This is referred to as an act of omission. Witnessing or learning about such an act, or experiencing betrayal by trusted people. So our doctors, our other veterinary technicians, things like that. Such potentially morally injurious experiences may lead to feelings of moral distress, such as guilt, shame, and anger. Moral injury is the lasting psychological, spiritual, behavioral, or social impact that may result from these experiences.
And in your opinion, how does that show up differently than burnout or compassion fatigue?
So it's very similar to compassion fatigue, but essentially, this is something where our moral compass is violated. This is something that we just wholeheartedly disagree with, whether it be a policy or just not being able to act in the manner that we know we can for a patient. This is separate in that way.
Yeah. What are some of the experiences that I know you mentioned financial, but in especially in ER and ICU, what are some of the situations that you've seen in that where moral distress really shows up, what does it look like in real time? Because we understand that, but I mean, you've been in it, right? So what are some
Right.
of those situations that show up in real time?
So I've had a patient show up a feline asthma attack, the very first one the cat had ever had, 2-year-old cat. He was in respiratory distress and we provided him with flow by oxygen, but we couldn't treat the problem because of finances. The owners literally had not a dollar to their name, and we didn't have any kind of angel fund or anything like that set up where we're able to go ahead and provide emergency drugs to coding patients or patients that may benefit from them in some way, shape, or form. In this case, if we had a bottle of epinephrine, this wouldn't be a first line treatment for feline asthma, but it would be effective. So if we had an angel fund and were able to provide epinephrine atropine for coding animals that come in that are financially restricted, then that would be, okay. But this cat ended up coding and I was not allowed to do anything. It was a DNR essentially. And I had to bring him back into the room to his owner who, was obviously distressed over his passing. And, she tried her hardest and we weren't able to provide the care that he needed.
So I imagine that experience made you feel pretty powerless in the moment. What did that experience teach you about moral injury? Is that the first time that you really understood what moral injury felt like and started this exploration of what moral injury was, or is that something that you had already experienced and this is something that made you actually put a term to it, or this is the one that seems to stand out? Is this particular one the one that really hits home for you?
This is just the most recent one that I've dealt
Okay.
with. I've dealt with this before in the ER and ICU, where we've sent a pet home with a free shot of methadone, but he had a hemo abdomen and was going to be bleeding out overnight, and the owners couldn't afford surgery. You feel really powerless when these things happen, and it can lead to some pretty negative emotions related to, our jobs and what it is that we do and how we don't get into this field to not be able to help the animals that come through our doors. So when we are unable to help them, it's very demoralizing. As far as, going ahead and putting a name to what this is, the most recent one just really got me thinking that what is this that what do we call this even? And it's moral injury. And basically, you know, the it's a lot of the things that, we deal with as healthcare workers, witnessing a great deal of suffering and death, than what's normally expected in a patient. These things are very distressful to our psyche. And when we're not able to care for ourselves the way that we need, we end up with a mental health crisis, which we already have in the veterinary field. So this is just amplifying those things.
Yeah. And so, I mean, you just mentioned that this creates this mental health crisis. And
Right.
so I imagine that when moral distress and moral injury build up and go unaddressed, it starts to show up in people in different ways, right?
Yes.
And then even in the team dynamic, what are some of those things that you see?
Essentially, people stop offering to help. They don't want to involve themselves in these kinds of cases because it's going to lead to negative emotions for them. When this cat was coding from feline asthma, no one offered to help me with him and they just stood there. So I mean, you feel pretty powerless at that point in time when even your team won't step in. I'm asking, can we give this drug? Can we give this drug? Can we give this drug? And I'm hearing no, no, no. And it's it's really difficult to, say to people that don't have any funding that I'm sorry, but there's nothing we can do and allow the pet to die in a tragic way.
Yeah. When you and I kind of chatted before this, you had mentioned that there's some of this anger and some of this frustration can sometimes be pushed towards the leadership. Can you speak to that a little bit?
Yeah. So when moral injury among healthcare workers occurs, it can be due to a difficult decision related to life and death triage or resource allocation when they believe that they should have been able to save a patient's life, but were not able to do so. And it's what we perceive to be unjustifiable or unfair acts or policies that lead to a sense of betrayal. So these things come down from leadership, right? And if leadership had said, all right, we'll go ahead and say, okay, we'll give this cat some Dex SP and we'll absorb that cost. That would have been at least us doing something. But leadership said, no, we can't do this. And it was a partner in the practice that specifically said, no, we're not going to treat this animal.
Yeah. And I think just for some context, there's different dynamics depending on the different type of practice, right?
Right.
If it's a private practice, if privately owned practice, if it's a
Mhm.
corporately owned practice, I think depending on that dynamic depends on the ability that people feel or the autonomy that people
Mhm.
feel that they have in
Right.
making those decisions. And I think that most people that listen know that I come from a corporate lens, but I
Mhm.
think that sometimes even in that corporate lens, there's sometimes, depending on what corporation, there's different abilities in
Right.
what each individual hospital managers, medical directors, and even associate doctors have as far as autonomy in making those decisions. How much can you discount? I've worked in corporations where discounts you had to get approved before you could do it, and I've worked in corporations
Right.
where you had a buffer where it was like you had a couple
Right.
$100 where you could do something.
Right.
Um, and then
Corporate
I've
tends to be better than private practices that are privately owned, I feel, when it comes to being able to discount things and eat the cost of these things. So we can't expect
Probably because
everybody.
there's a larger bucket.
Yeah.
That's a tough statement to hear if
Mhm.
you're a privately owned practice
Yeah.
hearing this. I
Hmm.
think that just for some context, also just to add there, the reason for that perspective is because if your hospital can't afford it, there's another hospital that can eat that cost. And so I
Right.
agree on a larger scale. I think that there's some perspectives and some opinions that might come out from that statement, but I think that
Right.
that you're not wrong. But I think that there's still, as a privately owned practice, you might hear somebody say, like, yeah, but I can make that decision on a one off basis. You can most of the time, though, right? You have to be really careful not to do that all the time because you don't have an extra bucket of money sitting on the side from some other practice that can, like, throw water on the flame if you've put yourself into a hole, right?
Right. I feel that, private practices have less leeway when it comes to discounting things because they don't have the money that corporate has. So it is easier for corporate to say, okay, let's eat the cost. It's harder for a private practice to say, let's eat the cost.
Yeah.
So I think that, one of the things that can be done is an angel fund of some sort, even for private practices, if there's a way to prompt people at the end of their exams and things like that to be able to roll over their change from $1 into an angel fund when they're paying with their credit card. I think that would be, something that is feasible for people, and it builds up over time. And the emergency drugs and things like that, they're not terribly expensive, but it may take some time to get to where you need it to be in order to provide those things to people. But that is a way that we can, address this situation.
One of the things that I know comes up whenever you're talking about either discounting or providing that care for those pets that owners can't pay for, right? Is how do you make the decision to treat for one and not the other? And I
Right.
know in past, we both have worked for a similar company, and I think
Mhm.
that in past there's that my understanding at least has been, if they are or they have a really good prognosis, those are the ones that you're gonna ideally choose over the ones that you don't. And honestly, the more I think about that, the more it brings up even more kind of morality and ethical questioning of
Right.
who's making that decision. And
Right.
I mean, the doctors have to then ultimately be the ones who that falls on. And what if they're wrong? And then we have to sit with that and live with that. And as a team, not just the technicians or
Yeah.
even the doctors alone, right? Like as a team, we all have to live with that. And did we make the right decision and all of that? And I think sometimes we don't sit down and really think about the weight of all of those decisions and how they compound over time. And I think
Right.
ultimately that's what we're talking about here, right?
Yes. Those feelings, they're not easy to work through. And when they build up like that over time, you're going to find yourself basically in therapy in order to try to unpack all of that, right? So at least that's what you would do in a, healthy situation of addressing it. Otherwise, people, have negative coping mechanisms for negative feelings. And that can be drinking, that can be drugs, things like that. It can be treating your coworker badly by, being short with them, having an attitude because you're frustrated. It can be a lot of different things. But I think that with the mental health crisis that we're having in the veterinary field, this is something we can address and that we need to address. And, if that means that we have to go out into the public and fundraise that way at state fairs, stuff like that, set up a table for an angel fund, I think that people would basically be more inclined to help knowing that this is going towards those pets and pet parents that can't pay and offering, a couple of dollars here and there. And it adds up.
Yeah. Yeah. Something that sticks out is kind of going back to the how we can how we can help each other, right?
Mhm.
In this is going back to the leadership piece. You had mentioned that leadership can kind of help prevent moral injury. Like it comes down from the leadership's decisions
Right. It
to
can be
say no or
policies
yes.
and
And
things like that.
so
Yeah.
you mentioned the angel fund, right? Not every I don't think that leadership necessarily can fix every situation, but I do think that they can plan ahead and be a little
Hmm.
bit more proactive. Do
Right.
you have any steps or ideas that hospitals can take to kind of minimize some of these decisions or some of these situations ahead of time?
Yeah. So figuring out what it is that you want to be able to provide to these patients, right? So do we need Dex SP? Are we going to expand this beyond just emergency drugs? Stuff that can really help an animal. Why not have a steroid on hand? But you got to figure out where you have to draw the line too. So it's difficult when it comes to animals that are young and do have a good prognosis if they were just able to be treated. And these things just, it builds up on the technicians because like I said, we did not get into this field to not be able to help animals. And when we're unable to provide that care, the the sense of betrayal from leadership because we were told no, we can't do this is there. So,
Yeah. For leaders that might not know that their teams are carrying moral injury because it's never been talked about, where
right.
do they start? Is there one small, meaningful change that they could make right now?
I think that just like with CPR, we debrief afterwards. So, why not debrief after difficult cases or cases that come in that we weren't able to, help save or they were financially constrained and that had a negative outcome? I think that debriefing helps to address moral injury in the team and can basically shed light onto how everybody's feeling about that situation and be able to move accordingly.
Have you experienced that in practice, what that looks like?
I have not. I think that debriefing after CPR is, a great thing. It tells us, what we can do better, what we did right, what we did wrong, and addresses all of those things. So there's clarity provided to each and every team member that was involved in that code. But, debriefing after difficult cases, I think that's something that we should really start doing.
Yeah. Yeah, I can't agree more. I think that that's one of the things that I actually encourage. Just having a hard time finding that word. It's
Hmm.
one of those things that I really encourage my teams to do after anything that's hard
Hmm.
and even good things, right? But really after a CPR, after a hard conversation, after a difficult client, after a
Hmm.
difficult case, after a death, after really anything that we could learn from,
Hmm.
I encourage them to sit down with their team and talk about it because we
Right.
don't actually learn and grow from anything that we don't talk through. And and I'm sorry that you haven't actually been able to experience what that looks like outside of CPR because I think that
Yeah.
it really is meaningful when a team can sit down and talk through what went well, what didn't go well, what can we do better next time, because that's where the real magic happens. That's where the real
Right.
learning happens, even with the difficult client, right? Like it doesn't even have to be a hard financial case. It can be
Mhm.
this client came in and was yelling at the front desk. How did we handle that? Well, this
Right.
is what we did. What could we do better next time? Next time this person could step in. Next time that person is better equipped for this conversation. Next time this
Right.
person can stop it. However that looks, right? And I think that being able to voice those things and have a culture where your team is able to feel comfortable, which brings up
Mhm.
psychological safety,
Right.
comfortable in having those conversations
Mhm.
is really important. And if you're not comfortable having those conversations, then we have a bigger problem. Yeah.
Yeah, de-escalating is extremely important, but the silence that builds up when you don't debrief, it fosters, more distrust in our peers and with leadership because a lot of the policies come down from them or the decision making does. And, I wish that people would just take those few minutes to figure out where the team's heads are at.
Yeah. Yeah. I mean, it sounds like what you're leading to is trust and accountability from leadership.
Right.
And so I think what would be helpful since this podcast, right, is really geared towards the leaders, is hearing from somebody who's on the floor
Mhm.
that hearing from somebody who's on the floor who can tell any leader in a hospital, like how do we build trust? How do we what are you looking for to from leadership? What does it actually look like for you, right?
For
Trust
my
and
I
accountability
would
from them.
say when I'm advocating for a patient, having that honored, that's what I'm looking for.
And not every time are they going to be able to honor it in a way that maybe
Right.
you want them to be, but I think
Right.
would you agree that honesty is where the in between lies?
Yes, absolutely.
Yeah. So I imagine what that really looks like is you coming to me as the hospital manager, let's say, and
Mhm.
saying, I really want this for X patient. And, I can't really do that because of my hands are tied in the situation. And instead of me saying no, and walking away,
Right.
I say, listen, I hear you and I understand the frustration in
Mhm.
your voice and the stress that this is bringing you. This is what we can do. Unfortunately, what you're asking for, we're unable to do. And this is
Right.
why. Like being able to give the why, I think really helps
Yes,
people.
I think
And
so too.
even if the why sucks, and even if the
Yeah.
why like doesn't even make sense to me telling you the why, this is
Mhm.
why, you know.
Right. I think that's just a an important conversation that we're not having. And I think that debriefing would basically cut to that and, help leadership to negate these moral injuries that the team is feeling.
Yeah. So let's talk about the role of the technician in this.
Mhm.
So, for those who might be feeling these inner feelings of conflict, right? They want to advocate for their patients, but they feel like they don't have a voice. What advice do you give to them?
Continue to advocate. Don't stop advocating for your patients. That case comes in that you've got, no funding whatsoever. Can we do this? Can we do this? Can we do this? Offer up solutions. Be solution and goal oriented, because there might be something that you come across that is a cheap fix to the situation, and that can be done. So, you just don't stop advocating for your patients. You know what they need, and that's the most important thing. I think that leadership, when given the options from the technician and whatnot, should definitely give us the whys, if we're being turned down, because we need to understand this to have that kind of closure of our emotions after the case is all said and done.
I think what you just touched on something, which is that the emotions, right? The emotions tend to run high, especially when we're advocating for our patients. I
Right.
Being a technician myself and now being on the operations leadership side, I tend to bring the clinical side into my leadership quite a bit. And
Mhm.
occasionally emotions run high, and it is sometimes really hard to balance the clinical brain with the operator brain. Um,
Right.
what to you does healthy professional advocacy look like in those moments where those emotions are running high and everyone's not on the same page?
I think that speaking calmly and making sure that you are just basically bullet pointing things, highlighting the things that need to be reviewed, and say, can we do Dex SP? Can we do Epi? Can we do this? Can we do that? Just get to the point, because obviously time matters, and, be calm about it. Don't be flabbergasted and, frustrated when you're speaking to your team. That's not gonna make anybody feel good. I think that having a plan in place would really help leadership to make sure that we are not dealing with these kinds of moral injuries on a daily basis like we are now.
Yeah. I think that one of the things that I hear the most from team members is that they are scared to speak up because they're scared to be retaliated against.
Right.
They're scared of being labeled as difficult. They're scared of being fired. They're scared that they will be cast out as the combative one, etc. So I think that advice of remaining calm and level-headed and bring to the table those bullet points of what is it you're looking for, right?
Mhm.
And maybe even afterwards, that's where the debriefing piece comes in, right? If it doesn't go the way you were looking for it, ask for the why.
Right. You can be passionate, but you have to be rational at the same time.
Yeah. Yeah. Because if you start going like, why can't we get the ducks? Like, what, get
Right.
it now, get it now.
Right.
Like, then everybody's gonna be like, what the heck is wrong with her? You
Right.
know?
Right.
Yeah.
So keeping your head level-headed, basically, making sure that you are strictly advocating for your patient, going through the things that we could possibly do to help. I think that that is the way to go about it, versus losing your mind on your team and why can't we do this? Why can't we do that? I think that the whys need to come from leadership versus, us having to question them. I think that it
Yeah.
just needs to be offered.
Yeah. You've seen and experienced a lot in this field. How do you personally stay grounded and keep coming back to this work with the same heart that you started with? Because Lord knows it's hard, and especially in ER and ICU, you're moral injury compounding over and over, and especially after you telling me that we don't debrief or you've not experienced that. I'm really interested to hear how you're personally staying grounded in all of that.
Personally, I would say that it's difficult to handle these things on a semi-regular basis. Even for me, even knowing what this is and, how we can improve and having some things to, fall back on and to put a plan in place, it's difficult. And that's why I'm speaking out about this because leadership needs to know that it's something that techs are constantly dealing with, those kinds of heavy emotions at the end of the day. So I would say that essentially that's a tough question, really is, because I haven't perfected this yet, how to deal with this situation, in my own life. And I've been in emergency and critical care for several years now, but it just doesn't get any easier. The years go by and people fail to plan, and so they plan to fail when it comes to the finances surrounding their pets and emergencies. And we can advocate so much, only so much about creating, a pet insurance fund or a pet emergency fund or getting pet insurance, things like that. But it falls onto deaf ears. So when we experience the inability to help a client and their pet, I think that's where we just get these awful emotions. And I would say that the places that have the angel funds set up, they usually require good prognosis, things like that, in order to tap into that. But some of the patients, they don't have that good prognosis. And with splenectomies and things like that, we are reseeding the abdomen, with tumor, and it's just, it's an imperfect system right now.
Yeah.
And it's something
Yeah.
that I think that we need to address a little bit more fully and figure out how we're going to address these patients and these clients that have very little money because we're not doing it adequately right now.
Yeah. I mean, I felt that. Yeah.
Yeah.
It's such a bigger conversation, I think,
Yeah.
but at the end of the day, it obviously affects you and your team and everyone that is working in the clinics. And I mean, the mental health crisis, there's so many reasons for it. This
Hmm.
is one of them.
Right.
Um, and I think that not being able to care for pets that, especially for financial reasons, due to whatever those reasons are, right? Poor
Hmm.
planning on the owner's perspective, all of those things. I think it then creates this bitterness in us as veterinary professionals because then you start hearing the opinions of, well, then they should have money if they want to have pets. And I don't think that's fair either.
Right.
Whose fault is it? Right? Then we take ownership of, well, we have to make sure that they can pay for it. But they
Right.
shouldn't have pets if they can't pay for it. And then it just becomes this like veterinary professionals against owners, right? Like, and
Right.
it's just that's not healthy either.
No.
It's either veterinary professionals against veterinary professionals or veterinary professionals against owners. And like, can't
Right.
we
And
all
there's
just
this resentment
communicate?
there. Right.
Right. There's resentment everywhere. There's
Mhm.
either resentment against owners, against each other,
Mhm.
against leaders. Like, we just can't all get along. I like, what in the world? But
Mhm.
I think that if we were able to, like you said, plan
Mhm.
better, knowing that these situations happen, right?
Right.
We can't fix the problem,
No.
right? Like, I can't go into each individual pet owner's bank account and put money in it. I don't have money like that. Sorry.
Right.
But and I can't make them change. So
Right.
what I can do though is plan for the situation. And I think that if we can do a better job of planning for the situation
Mhm.
and talking through when the situations do occur so that we are doing better each and every time,
Right.
then that is probably the best things that we can do, at least for now, until
Right.
larger conversations can continue to happen and continue to get to those root causes that address the owner's
Mhm.
financial situation and address all of the other situations here. Yeah. If you could leave leaders and technicians with one big message around moral distress, something that you wish every
Yeah.
hospital would really take to heart, what would it be?
I think that um psychological safety is a big topic that we need to feel when we come into work, that we are in a place that can accept our flaws, our faults, and our mistakes. But in the face of moral injury, I feel like that psychological safety just goes out the window. And um, I think that addressing these cases, that with a plan in place, that's the best way that we're going to come through this, because like you said, we can't change the owners, we can't put money in their bank accounts, but what we can do is figure out a way to create those angel funds and at least do something for these animals, because it's better for the veterinary professionals and the team as a whole, and that's what we're really treating, right? At the end
Yeah.
of the day, we're treating the patient, but we're treating ourselves as well. And that kindness towards others is the biggest thing that we need to start addressing. I think that leadership checking in with uh, the veterinary team after difficult cases is also something that needs to start happening. Figure out where everybody's head is at, what we can do better next time, and how we can treat these cases better in the future, and coming up with those solutions. The whole thing is being goal oriented, being solution oriented.
Yeah. I want to not forget to tell you that
Mhm.
you don't have to perfect anything, right?
Right.
Because you said that you have not perfected it. That's
No.
okay. I don't
Yeah.
think you ever will. I
Yeah.
think that it is absolutely okay
Mhm.
to not be perfect and
Yes.
not be able to sit here today and be like, I've figured it out. That's okay, right?
I
Uh
am a perfectionist at heart. I have a tattoo that says a beautiful thing is not always perfect, to remind myself that I do not have to be perfect. So every time I look in the mirror, I see it, and it just reminds me to chill out a little bit and not have to come from that place of
yeah.
perfectionism.
Yeah. I think that it's important to note, right, that that's one of those things, especially when we're talking about the way that our minds are going to take certain situations and experiences
Mhm.
and the onus that we often take on when certain things happen and we take responsibility for them when they aren't necessarily our responsibility and all of that, right?
Mhm.
There's no sense in thinking you'll ever get that necessarily perfectly right. And
Right.
there's nothing wrong with you if you need some time to digest it and go through it and let it sit. If anything, there's beauty in the imperfection of that. So
Right.
I just want to make sure that I said that. The one thing that I always ask is, and it may or may not actually be relevant here, but it doesn't have to be about moral distress. Just in
Mhm.
general, is there a book that you recommend anyone in vet med? It can be vet med related in general, and it can be yours if you'd like it to be. That you recommend anyone in vet med that you come across to read.
Yes, it would be my book actually, because and there's a very good reason for that. One, it helps people with the VTNE, so baby techs that are just coming into either going into GP or ER, ICU. It helps with all of those things, but there's so much that is provided to you information wise, if you are working in ER and ICU, that I refer to my own book on a daily basis. I can't remember all of these things and keep it in my head, and dosage ranges and things like that. And having it all on my phone, it's it's the best thing ever. I'm trying to finish up the second edition right now. I have a couple of articles that I'm going to be writing with some contributors, and we're finishing those things up. And then the book should be out on Amazon probably by the end of the year, I would say. So it'll be on Kindle as well, so you can have it on your phone. Yeah, I'll have on vetmedmathtutoring.com a way for you to download the PDF too, if you choose to have it on your phone versus the physical book.
Yeah.
Um, and I'm telling you, there's so much information that I have tried to include in it. I've tried to think of everything possible, every case that we see. What can we put into this book about this case so that you know what you're doing? You know, I think that those people that are learning dilutions, that are learning CRI math, the way that I teach CRI math is not with dimensional analysis, it's with linear algebra. I think that way is much more user friendly. And I've gotten nothing but praise for doing that for VTNE takers. So I would definitely recommend my book over anything else. The second book that I would recommend, though, is the Anesthesia Nerds book on pain management and anesthesia that they just came out with. And this is for those practices that, don't really delve into the ketamine, the methadone, the fentanyl, and are still in the Dexmed and Torbis pre-meds arena. I think that having some hard evidence that shows we can reduce pain in all of these different ways with these meds, it helps you make your case to leadership.
Yeah. No, I love that. Awesome.
Yeah.
Is there anything that we have not touched on today that is sitting on your heart that you really want to make sure gets across?
No, I think that we basically went through exactly what healthcare workers as a whole experience on a daily basis. We are interconnected with our patients, and those emotions that we feel towards them, are hard to sit with sometimes at the end of
Yeah.
the day if we have a negative outcome. So
Yeah.
I think that the best that we can do is, plan ahead and prepare for those, negative outcomes, and, what we can do better next time.
Yeah. For those who want more from you, where can we find you?
You can go to vetmedmathtutoring.com, and there's ways to contact me. I also have a bunch of free lectures, calculators, things like that are available from my blog on vetmedmathtutoring.com. I like to put out as much free information as I can, aside from my book, and let people in veterinary medicine have as much information as they can get with not having to spend any money on it.
Yeah. Awesome. Well,
Mhm.
Kristen, thank you for bringing your honesty and heart to this conversation. This, like I said in the beginning, this isn't an
Absolutely.
easy topic,
No.
but it's such an important one.
Yeah.
And I hope this episode helps more leaders and veterinary team members understand that moral distress isn't just a part of the job. It's something that we can actively prevent by leading with empathy, planning ahead, like you said, and never forgetting why we do the work that we do in
Right.
the first place. So
Remember your
thank you so
why.
much. Yeah.
You're welcome.
Thanks for listening to Leading Veterinary Teams on Air. If this episode hit home, share it with a colleague, tag us on Instagram or TikTok, or leave a review. And don't forget to subscribe. It helps more leaders like you find their way. And remember, your job is not to do it all, it's to lead in a way that lasts. I'll see you next time.